Hi everyone, welcome to this video. So today I'm going to be talking about the dreaded medical school interviews. So I was lucky enough to do 4 of these, as I got the interviews for all 4 of the medical schools I applied to. One of them was Cambridge, so they have a different interview system to most of the other medical schools in the country. So most of the medical schools in the country do MMIs, multiple mini interviews, and this was the format I had for 3 of my interviews, and I got offers for all 3 of them. I'm just going to sort of talk about what the interviews involve, how to prepare for them, how to do well in them, but also how to enjoy them and not dread them. First thing is first, something you're going to have to accept is that you are going to be very, very nervous. Of course you are. This interview is literally going to determine whether you get into a medical school or not. This is basically your whole future, whether you're going to be able to study medicine and become a doctor. So of course you're going to be nervous, and of course these interviews are a massive deal. So you're going to be nervous. So how can we reduce that anxiety for possibly the biggest interview of your life so far? Preparation. So I'm going to talk through some ways that I prepared and some things that are useful to do, and I almost treated my medical application as another whole A-level. Honestly, I put so much work into it, because the more work you put in, the more confident you're going to feel going into the interview, and that really is going to show. So what can you expect to happen at your MMI? You arrive, you sign yourself in, and then you sit in a sort of waiting area with a lot of other nervous people, and there's a lot of nervous chatter. I found that quite nice, just to relax, like just to chat to people. And then they do the interviews in sort of like groups. So I was lucky enough, I was always in the first group, so I just went and got my interview done and then could leave. Some people had to wait in the waiting area for longer. So if you can, it's best to sort of get yourself into the first group, just by sort of sitting near the front, for example, because then you can get your interview done and you don't sit there for ages feeling anxious. So then how it works is there are multiple stations. The ones I did, it was between sort of 6 and 8 stations, and they allocate you one to start at, and a bell goes and you have, I think, about a minute to read the instructions that are outside the station, and just try to stay calm when you read them. Honestly, take deep breaths, read it slowly, give yourself time to think about what you're going to talk about in your head, make a little mini mental mind map of all the things you can think of that relate to this particular scenario or particular question. And then a bell will go again and you go into the interview area. This will either be a room, or it will be sort of like a curtain, like on a ward, like a curtain that you pull across and go in. And then you begin the station. And the stations can feel like they go really fast or really slow. So some of mine, I felt like I was talking really fast to get in everything I wanted to say, and I knew that time was running out. There's normally a bell that goes like a minute before the time's about to run out, and you normally only get about 7 minutes or so to talk, but some of them I felt like they lasted ages. You come out the station you've been on, when the bell goes, you move on to the next station, then you have another minute to read the instructions for the next station before you go in and complete that one, and you go around the whole circuit and then you're done. One thing I would note as well is that in interviews where it was like curtains between the stations, you can actually hear other people doing their interviews. So like you can hear the station you're about to go to or the station you've just been to. You can hear the person talking, and try not to let it put you off. So just try to stay really, really focused on your station. And I know it can be hard because you can almost hear the questions that are going to come up in your next station. So it can be tempting to try and listen so you can get a head start, but actually that's going to be detrimental, because then you're not going to be focused on the station you're actually in. My biggest tip for all of the interviews, goes for any interview, is just smile and look interested and look excited and confident. And if you get asked a question and you have absolutely no idea what to say, just give yourself time to think. Just say something like, oh, that's a really interesting question, let me think about that. And then the interviewer knows that you're going to give the question a go and give a well thought out answer, rather than just jumping in with something random. And it's fine to be wrong in an interview, and if the interviewer then corrects you, just definitely go with them. So what types of stations are there going to be at an MMI? So I'm going to give a brief overview of some of the types of stations that you can expect will come up, and basically how to prepare for them. Work experience is going to be a theme that they are going to explore. While you're doing your work experience, hopefully you've made some notes or like a sort of diary of what you did or what you saw and what you learnt from your experience. So you can read that then before the interview. Count moments where you really learnt something valuable. And this is important because they don't want to hear that you walked around a ward for 4 hours and you got to see loads of cool procedures. They want to see that you've learned something from your work experience. That could be something ethical. You saw an interesting ethical dilemma, or it could be you had a chance to speak to a patient and you really got to improve your communication skills. It could be that you observed a conversation between a doctor and a patient, or a nurse and a patient, and you thought that they communicated really, really well, and then you learned some good tips from that. Those are the things that are important for talking about work experience. Also, a key point regarding work experience and volunteering, the most important thing I can say is that it's not about necessarily quantity, it is about quality. So it doesn't matter if you've spent a year shadowing a consultant in a hospital, whereas someone else has done 6 weeks of volunteering at a care home, because the person shadowing a consultant in a hospital might have done absolutely nothing for that year. They might have just observed. If you volunteered and done a hands-on experience, that's going to be a lot more valuable. It will provide you with a lot more experiences that you can talk about in detail at interview. Hands-on experience is what interviewers love to talk about, and knowing what you actually did and what you learned rather than what you saw. So another topic that stations can be about is your own personal characteristics and attributes. And these are going to be attributes that will make you a good doctor in the future. And so it's important to have a think about what kind of attributes these might be. To give a few examples: good communication skills, good empathy, good resilience, good organisation. So things like this, you can literally, what I did was I had flashcards. So I'd have, for example, an empathy flashcard, and I'd write empathy on the back, and then on the other side I would have maybe 2 or 3 examples of times I've been empathetic. So once you've made flashcards, then you can learn them. So then when in an interview you get asked about one of these attributes, you've got an answer structure kind of in your head already. Not to learn it word for word, but just to have an idea, so that you don't sit there having to think of examples of times when you've been empathetic, but instead you've just got them in your head already. It's important that these examples are specific moments you've shown this attribute and how you've shown it, rather than a general sweeping statement to say that you are always, for example, resilient or always empathetic. You need to have a specific example. If these examples can relate to your work experience, or volunteering, or any time when you've been involved in healthcare, that can be even more beneficial and be even better to talk about in an interview. So another type of station is roleplay. I think these are quite fun stations, and they're quite good ones because you don't have to have a particular knowledge for them. You don't have to have done loads of research. You don't have to have answers prepared. You literally can just go in and be yourself. Chances are, if you've got to the interview stage of the medical school application, you are going to be a kind, caring, friendly person. So just show this off to the examiner. Show off your characteristics and your attributes that would make you a good doctor. There's nothing else you can really do to prepare. So just be confident in yourself and enjoy them. So ethics is a station that is very likely to come up. And what I would say about ethical scenarios is, don't rush in and give an answer. There's often not a right or wrong answer. The interviewer is more looking to see how you approach issues and whether you can identify the issues that are important. So for any ethical scenario, I would give the advice of using the 4 medical ethical pillars. And you can structure an answer to any ethical scenario around these. So these are autonomy, which is the patient's right to make decisions about their care. Beneficence, this is doing good and working in the best interests of the patient. Non-maleficence, this is doing no harm, doing your best not to harm a patient. And justice, making sure everybody is treated equally in healthcare. So whatever question is thrown at you, you can identify which of these pillars are relevant and then structure your answer based around these, and that is a really good way of answering these ethical questions, and it shows that you have a really good understanding of ethics. There's other things that are important to note about ethics, so confidentiality, knowing that a doctor must keep confidential anything that a patient discloses to them. There are exceptions to this, which you can read up about. For example, if a patient tells you they're going to harm another person, you are allowed to breach confidentiality to keep that other person safe. And things like Gillett competence, this is the assessment of whether a child can make well-informed decisions about their care. Just things like that are important to know so that you can flag them up in an ethical scenario if they arise. Yeah, so knowing about capacity is also a good thing. Capacity is the ability of a patient to take in information, retain it and use it to make a well-informed decision about their care, and assessing whether a patient has a good mental state and capacity to be able to make decisions about their care is really important, especially in things like dementia patients. Yeah, so ethics will be fine. Another station I wanted to talk about was why this medical school. So the interviewer will ask why you've chosen, for example, University of Nottingham over all the other medical schools in the country. And you want to make sure, definitely, to the interviews that you go to, that you have a really good understanding of the course and how the medical school teaches. So some universities like Nottingham have a more traditional approach, so they have more lecture-based teaching, whereas others have more PBL style teaching. So you definitely need to look into that, so then you can structure your answer based on you think you'd learn better from lectures than you would PBL, or vice versa. It's also important to know any sort of standout or special features that a medical school has. So the University of Nottingham, for example, is one of the only ones, it might only be like 2 or 3, that have full body dissection as opposed to prosection. So this is something that you could bring up in the interview and say that that really appeals to you. Or maybe you might prefer prosection to a full body dissection, and therefore you could talk about why you prefer that. And of course you can also talk about general university features, so maybe you really like the campus, or you really like that it isn't a campus. So whatever reason you've chosen that medical school, just make sure that you make that really clear to the interviewer. Another type of station could be a more sort of abstract one. So these are ones that kind of throw you off. You can't really predict what they're going to be. So these could be things that test, I don't know, for example, your dexterity. There's a whole range of weird and wonderful stations they could throw at you, but there's nothing you can do to prepare for these. You just have to kind of go in with an open mind. Other stations could be about things like NICE and other organisations involved with the NHS, or things like GMC, what they do. And it's important to have like a basic knowledge of this. Nothing major, like you need to like learn loads of statistics and things. Just having a basic understanding of the NHS and things influence it. Lastly, another type of station that could come up could be your motivation to study medicine. And to be honest, I think this came up for me once in all of my interviews and all the stations I did. But yeah, it's important that you have an answer to the question, why do you want to study medicine? It needs to be honest and it needs to be clear. Just, as long as you're not just saying, because I like to work with people and I like science, because that is just the absolute cliche. And when you talk about why you want to study medicine, say it based on experience. So say that you've done work experience and this work experience taught you so much about what being a doctor is like and that things really appeal to you, and then give examples of things that you've seen that directly appeal to you. Or talk about your volunteering and things you really enjoyed and how that would relate to being a doctor, and that's why you think you'd really enjoy medicine. A lot of people say it's because of the lifelong learning opportunity. There's so many different reasons why people want to do medicine. It's important that you just know yourself what your reason is. Another station that can come up is one that can be about recent news articles. Now this can catch you out if you're not prepared for it, because they can ask you about, for example, a recent bit of research that's been done or a recent article that's relevant to healthcare. So it's important to have a couple of articles up your sleeve just in case they do ask, and to just have a good understanding of them, so you can talk about them in detail and then discuss like elements of them that interest you. So this kind of concludes the video. I'm sure there's stations I've missed out, but I'll just make more videos on them if I remember them. The important thing is to know you are good enough to get into medical school. Go into the interview with confidence and smile and know that you are deserving, and you'll be fine. Just do your preparation. Don't leave it to the last minute. So if anyone that has a medical school interview coming up, I know a lot of them will have already been, but good luck. I hope it goes really, really well. MMIs are scary and they're hard, but it's worth it in the end, I promise. Please give it a thumbs up if you liked it and if it was helpful. Bye!